Well, good afternoon, everyone, and welcome to our Five Faces webinar, Beyond Maps, Transforming Patient Experience with Smart Wayfinding. Thank you so much for joining us. Everyone's coming online now, and we're really grateful to have such a big interest and a big audience online with us today. I'm keen to learn about this topic. My name is Ashley Mansfield. I'm the Partnership Manager at Five Faces, and I'm really glad to moderate this discussion on all things wayfinding and the technologies and innovation in this space within the health sector. Uh, at, at Five Faces, our mission is to make healthcare easier to deliver for health services and easier to experience for patients through digital solutions that streamline the patient experience. And a large part of that can be physically navigating complex hospital and health campuses, often for the first time and often under pressure, whether you're a patient or a visitor. And incorporating smart and thoughtful wayfinding into this process is an important consideration and often a large digital transformation for hospitals and health services. So, for this discussion and webinar, we've invited industry experts from WiseNav and Eyedog to support the discussion and explain kind of three key themes, which is why wayfinding really means in a modern hospital context. What's the business case for smart wayfinding, including understanding the impact on staff time, infrastructure needs, and maintenance costs to support that system, and how photo landmark navigation compares to beacon-based approaches. To begin, Five Faces would like to acknowledge the traditional owners of country throughout Australia and their connections to land, sea, and community, and we pay our respects to elders past and present and extend that respect to all Aboriginal and Torres Strait Islander people online with us today. So I'm very glad to now welcome and introduce our speakers. First, we have Shay Groom, the Director of WiseNav. Shay has been in the signage and branding industry since 1992 and the owner of a Wellington-based sign shop since 2011. Shay has an extensive experience within signage and wayfinding and joined the board of the New Zealand Sign and Display Association in 2020, including serving 3 years as president during a period of significant change for the industry. And also Ralph Michaels, the CEO and founder of Eyedog. Ralph holds a master's degree in civil engineering with a specialisation in GIS and operations research. This background led to the creation of Eyedog, which is a digital patient wayfinding platform currently used in more than 60 hospital environments globally. He's also a PhD researcher at TU Delft, where his research focuses on aided pedestrian wayfinding in healthcare environments from a transportation and planning perspective. So a lot of knowledge here, and thank you both for joining us. The three of us, we're across 3 different time zones at the moment. It's evening for Shay and early morning for Ralph, so I owe you both a coffee next time I see you. In terms of housekeeping, of course, we invite you to submit questions throughout the discussion. Please just use the Q&A box at the bottom of the screen, and we hope to reserve some time at the end for Q&A. And also throughout the discussion, we'll take some intermissions to share some poll questions, and we really appreciate your participation and responses there. Other audience members will not be able to see your questions or poll responses. So with that housekeeping underway, we're going to launch straight into the discussion, which we're going to keep it quite conversational today, and we're going to start from the beginning and the basics of understanding what wayfinding is and how it's placed within the hospital environment. So, Shay, if you can start this for us, and in its basic form, what is wayfinding?
Oh, thanks, Ashley. Well, in its basic form, it is just how people figure out where they are, where they need, where they want or need to go, and how do they get there. It really is as simple as that. That's all people are looking for when we think of wayfinding. Good wayfinding reduces confusion, it reduces stress, it reduces lost time and staff interruptions. It also does things like assist contractors and visiting family members and anyone that's new to your facility, really. That's just the basic breakdown of what wayfinding is.
Yeah, fantastic for getting from your start point to your end point, I suppose. Um, Ralph, can you explain how, the system behind it and how the human brain approaches following a map in a normal circumstance, and then how that cognition is affected in a stressful hospital environment?
Yeah, thanks, Ashley. Well, research says that people find it hard to use a map to support a wayfinding, and research makes a differentiation between uh, um, two types of wayfinding. One is allocentric, one is egocentric wayfinding. Allocentric can be compared like that. You have, let's say, a mental map of the place, of the surroundings around you. Like, for example, if you know Paris a little bit and you see, for example, the Eiffel Tower somewhere in the distance, and you need to go to the Arc de Triomphe, then you know approximately where to go. That is called allocentric navigation. And egocentric navigation is just follow the cues along your pathway. You have no idea where you are, but finally you get to your destination. And that's what people like to do in large buildings, because especially newcomers in patients that have, let's say, not visited the hospital for at least a year, they don't know the facility, and you should not give them the burden of learning the facility in order to find their way. They should just simply follow simple cues. That's either by just following a line of information, like, for example, signage cues at the different wayfinding intersections, or just following the cues from your cell phone. That's what people prefer.
Yeah. Thank you. And an interesting point about when there are changes to a building. There's, a very large capital program happening for hospitals across the Australian and New Zealand market at the moment. So where there are those expansions, as you say, not burdening patients and visitors to figure out what the new navigation looks like for them.
Exactly, because hospitals, they change over time. Sometimes it can look like a popular belief if people because everyone can relate to the fact that, oh yeah, hospitals are complicated. Yes, I got lost in hospitals too. Sometimes you have the feeling it's a popular belief, but it's not. There has been research, and that research says why people get lost in hospitals. And there are a couple of reasons for that. One is the complicated layout of hospitals, also building parts that have been built over time. So that makes the layout also very complicated. People are very nervous because it's totally different when you go to a hospital and trying to find your way, or when you go to a shopping mall trying to find your way. Your mental state is completely different because people are anxious or are nervous. They don't know what's coming next for them. So these are very important factors that lead to confusion and people getting lost in hospitals. And one of my personal research topics is that I'm claiming that we are providing the wrong tools to people. For example, giving them maps in a hospital environment, that is super hard for people, because then you push people to learn about the environment and then try to give them, let's say, just well, you try to push to learn them about the environment, and then try to make sense of the tools that they have, and that's really hard in that cognitive state where patients are at that very moment.
Yeah, absolutely. I think all of us would have been in the position where we're paying a visit to, a friend or a loved one in a hospital, and you simply just want to get to them as soon as possible. So having to navigate that is just it affects the experience quite quickly. So we'll soon be speaking about what you're doing at eyedog in terms of the innovation of photo landmark technology. But what are the current kind of wayfinding systems that hospitals are using today? To either of you, maybe Shay can
Yeah,
kick.
yeah. Well, there's several different types of wayfinding. There's obviously signage. You got some directional signs on walls. You've got arrows. You've got names on doors. There's obviously some risk with those when, as Ralph just mentioned before, hospitals get added onto. Gets a bit confusing. You're relying on people to remember them. There's, signage, sign blind, where people just don't see them anymore. There's use of color in hospitals. We've all seen the red or green or blue line on the floor to follow to get to a certain place, a bit like a spaghetti junction. Maps, um, maps on walls that have different colors for different areas of hospitals or universities. Um, there's landmarks, so you can have distinctive walls or distinctive roofs or buildings or doors or features. That's another sort of random type of wayfinding. And then, of course, you've got your digital wayfinding, which is the use of maps and plans, moving dots, photos, interactive kiosks, all those sort of things. So there's several different types of wayfinding, and a little bit of everything is probably the best way to go. But there's lots of different options out there for sure.
Yeah, definitely. Ralph, anything to add about the current systems that you see?
Yeah, well, there are different tools for people to support the wayfinding process. And what you often see in hospitals is, well, I've come across, I've been into tons of hospitals, luckily not for medical reasons, but just for professional reasons. And the things that Shay just mentioned, so there are a lot of interventions possible for to support wayfinding for people. But most things you see is signage, but it's super hard to solve to create a good supporting system only using signage. And that's simply the case because people have follow-up appointments in healthcare. So if they have, let's say, an orthopedics appointment, they might also need to go to radiology to have some x-rays and maybe do some blood work, and then afterwards getting back to radiology. Or you have an appointment at neurology and then you need to go to the pain clinic as well. So there is a lot of dependencies, and so in fact you need to find your way inside a hospital from any place to any place. So imagine if you, let's say, have 150 locations. This means inside the hospital, this means you need 150 times 149. It's more than 20,000 routes. That is super complicated to lay out a plan for, and that's where digital support comes in and is super effective for that. And when you look at digital support, you have a couple of different approaches. You have the approach with just a plain simple map that creates a route for you on top of that. I don't personally call that a wayfinding system. It's more a path planning system. You actually need a turn-by-turn navigation, so that provides prompts at the right time, navigational prompts. So then you have this map with a route, with a pathway depicted on it, and then giving prompts based on the moving blue dot. And you have the photo landmark navigation that we will discuss later on. And there is also some visual navigation that's support that's with AR. There are pros and cons for everything. So.
Perfect. Thank you so much. I'm going to launch our first poll now. If you would all just look for the pop-up in a moment and just, quickly submit your response. How easy do you find following a map in a hospital campus you're unfamiliar with? Couple more seconds and I'll close that off. Thank you. If I was personally answering, I'd say I get lost every time, just for the record. But I'll shut that down now and share the results, which is the majority of people said it's manageable, but with a few wrong turns along the way. And of course, part of it, which I'm sure Ralph will speak to, is those wrong turns adding up to a broader kind of patient flow and productivity argument where there are interceptions along the way, and refinding the pathway. So if we can turn now to the eyedog technology specifically, Ralph, I'd love to hear from you how eyedog came about and the particular technology and what the key points of difference are between photo landmark navigation and the other types of technologies currently used that you've just explained.
Yeah, it's when we started the company, we had this. Well, I have to give one person a credit, and that's my dad, who was in the wayfinding design business for almost 40 years, and he has done a lot of wayfinding design projects in healthcare. And I was discussing with him when I was still in university how digital tools, especially on devices, could support people. And one of the things he always mentions that don't use any maps. That is super hard for people. So that is something that I put in the back of my mind, and we have been co-developing it just verbally for 20 years. And then I came up with the idea of using pictures. And he has been saying for at least 50 times, no, this is not going to work, your approach. And then I came up with the idea of photos. So give, let's say, a narrative, a visual narrative, augmented with navigation instructions. And it was the first time he said, this is gonna work. So we built a prototype and we tested it, and we were super surprised how easy it was for people. And so we started in 2014. And we also jumped on that bandwagon of creating apps. Everybody was creating apps. So we created an app as well. But we learned the hard way that people don't like to download an app until there is a really persistent a reason for it. And wayfinding wasn't. And we didn't understand why. And we found out that people, just for wayfinding in a certain building, don't go to the App Store and download an app. Once they downloaded it, they loved it. But for making people download an app solely for the purpose of wayfinding, people don't do that. People just walk into the hospital, they suddenly find out they're lost, and what they do is they don't go to the App Store, try to find an app to download it. No, it's simple. They grab somebody with a medical uniform because they know that person works here, they know the hospital, and that's exactly what the hospital doesn't want you to do, because these are doctors, nurses that are doing their job, and you want to bring autonomy to people that they can find their way on their own. So we reverted back. So our solution is not only easy to use, but also easy to access, which is super important.
Yeah, absolutely. And when you say not giving people a map, I mean, the poll results that we just saw in terms of it's manageable, but I make a few turns. The eyedog solution has been implemented in over 60 hospitals. It's based on deep research, and you must have a lot of feedback and evidence based on its success. How do you what do your success rates look like in terms of people being able to find their destination on the first time and avoiding that kind of few wrong turns along the way, smoothing that out to first time being correct?
Yeah, it's the problem with wayfinding support tools it's super hard to understand, first of all, whether people are using it. For example, signage in a hospital. We don't know if people are using it and to what extent. We also don't know how effective it is. We cannot see that. We cannot measure that. It's super hard to do that. We would love, from a scientific perspective, we would like to understand how effective these tools are. When things becoming digital, you get more information on the efficacy of these tools. And what we see in our system is that it's being used and it's also very effective. Being used is tied to a topic that we will touch upon a little later. But being effective is of course super important because you want to give people tools that really do the job. And what we can see in the data that we have, we use, of course, because of the high usage that we have, the data becomes very relevant and meaningful. And what we see is that we have a success rate of more than 94%, which is very, very high. 100% is impossible. We have done tests as well. For example, with a brand new hospital in Belgium that was tested they tested all the routes from entrance to all endpoints, and it was done by staff members who did not know the hospital because they were moving into a completely new hospital, and it was 100%. That were 100% effective. But these people were not nervous. These people were not real patients. So we have the data of real patients that are nervous. They are facing perhaps maybe a very terrible message that they will get from a doctor. And that data shows us it's more than 94% effective.
Fantastic. And of course, an immediate question when you speak about the state that the people and the patients are in terms of stressed or not so stressed, you immediately think of how the technology is also accommodating vulnerable patients. So Shay, how it does, photo landmark navigation and this type of technology also consider and, service and work for those who are older, neurodivergent, have low literacy or vision impairment, general accessibility requirements.
Yeah, absolutely. So the eyedog WiseNav interface, as Ralph just said before, it doesn't require an app, so that gets rid of one technical requirement. It basically just pops up in the case system, so it's very easy to use from an email or whatever the communication is from the hospital. It maps out the entire journey that you're going on before time. So you can, as you're going to see in the video shortly, you can see where you have to be, and then you're following the journey. So you know all the things you're going to come up against on the journey. You can do the whole thing the day before, the week before, the month before, or all three, even the morning of. So you get a very clear picture in your mind where you're going, what you're going to encounter, and all those sort of things. Working on actual photographs of where you're walking through just gives you a level of comfort and confidence that you're going in the right direction. You're not sitting there thinking, am I lost? Am I following down the wrong hallway? It's just that confidence is there instantly because, it can be seen where you're going. The text and interface is very clear. So even if you've got 50% sort of visibility, you can still sort of see where you're going well enough. It changes very fast between an accessible way to get from A to B to the most efficient way, and then back again. So if you do require no escalators or just lifts only, then the interface just changes over within sort of seconds. It's got so many different sort of ways of helping people of all different levels of disability and languages too. So whether it's multiple languages, it's got to select which language you want at the top of the interface. So it's very clean and easy.
Fantastic, thank you. Yeah, it's a very good point about being prepared and supporting patient preparedness that extends to, getting them to the right clinic or the right place.
Yeah.
I will always look up a route wherever I'm going to a restaurant. I'll get onto Street View and have a look at the actual images to place myself. So,
Yeah, it just makes so much difference. Like my very first time using eyedog was in a hospital in Amsterdam, funny enough, and there was absolutely no English anywhere, and I was able to find my way around just by purely looking at the walls and the environment that I was in. So yeah.
fantastic, thank you. I've just launched our second poll. Please, if you would all review this and respond in the next few seconds. How would you describe wayfinding in your hospital today or your local health service? Couple more seconds. Cool. Our results here are sitting towards it being heavily reliant on staff and of course volunteer cohorts to provide directions, as well as it varying by site, which of course presents a consistency issue as well, particularly if it's within the same health service. So in terms of selecting the right technology for your type of hospital, type of campus, style and land layout, let's talk about the business case for hospitals and the different technologies present to hospitals in that instance. I'll throw it to both of you. So whoever wants to take it first, what's the business case? What does the Frodo Landmark technology in particular offer to hospitals?
Yeah, it all starts also with what you can measure, of course. But if you there has been a professor a long time ago, it was in the 90s in from Georgia Tech, who looked at what are the costs of confusion. That is how he mentioned it. And he was trying to put some numbers on that. And he was only looking at two factors. One is interrupting staff, and the other one was late and missed appointments due to wayfinding issues. Also, he factored in the maintenance of signs, and he came to a conclusion that was 220,000, excuse me, US dollars per year. That was in 1990. We did some research on that as well, and we came to the same conclusion. Today, when you factor in the inflation, it's around a half a million, but then it's a half a million US dollars. But that is only related to these two things. But there's many more. But these are quite hard to quantify. And what we also see is that it gives also informed decisions. We have a client in the United States, in Colorado, and due to staff shortages, this is just a very simple example. Due to staff shortages, they had to shut down different entrances. Also, one entrance where the bus stop is. So people had to find their way all the way to the ED. They had to go through the parking garage. It was terrible. So they put up a QR code over there so to guide people more easily. And then they saw in the analytics how many people are actually using it. So they reported that immediately to the board and said, "Oh no, we have to really open up that entrance again because it's such a terrible patient experience." And patient experience, it's really hard to quantify. So there are tons of ways that it will benefit a patient experience as well. So you have the benefits, but if you invest in a system, you have also your investments in that. And there is with the iDoc solution, you don't need any hardware. So no beacons, no Wi-Fi stations. Well, you of course the Wi-Fi stations are mostly there, but you don't need to invest in additional hardware for that to accommodate indoor location technology. So no beacons are required. So the investment is much lower, and what you get out of it, considering the high success rate and especially the high user rate, gives a very positive business case.
Absolutely. Shay, anything?
No, I think Ralph sort of covered all of it there. Yeah.
Yeah, we might roll into discussing how then the technology can be rolled out, how it's integrated with solutions like digital front doors, how it's supported by other assets that I suppose fall into the wayfinding category as well, in terms of signage and directory boards, digital signage, digital directory boards via QR codes as well. So I'm going to share what that looks like for Five Faces and our offering in the digital front door in the patient hub space. You'll see how that clicks out from a patient's appointment into the solution, which can be configured to the correct location to start with. But Ralph, how is your technology integrating with digital front doors?
Yeah, it's what I always say to our clients is, or when we talk to prospects in the market, it's super important that you do integration in touch points, because you don't want to bring the patient to your solution. You have to bring the solution to the patient. That is very important. And you need to bring it in such a way that you remove all barriers to enter that solution. So our solution is not app-based, because you don't want people to, when it's integrated into a digital front door like Five Faces, from the appointment notification or from your appointment screen, your appointment details screen, time, date, name of the doctor, how can I find my way? You don't want the system to look for another app and then get redirected to the App Store. You want that to blend in seamlessly, and you want to give access to everybody. So that's what I mean with bring the solution to where the patient already is, into it, and a familiar communication environment. So integration is super important.
Thank you. And as you say, talking about the touch points, and again, when you're lost, you need the technology to find you. You can't go back to the start and pick up the wayfinding. You're already halfway down a corridor and needing it to be in your hand.
True, true. And what I mean with bring the solution to the patient is because it's super important that they can prepare ahead of time. So once you get an appointment notification, or let's say in your digital front door, or maybe from an SMS text reminder 2 days before, please remember you have an upcoming appointment, or you want to know how to get there, please use this information. So people can already familiarize themselves what their journey is about, how to get there by public transport, how to get there by car, where to park, which entrance to use, and from how to get from that entrance. They can look at the visuals and they can familiarize themselves. That's how I need to get there. I need to remember that on Thursday morning when I get out of the door, have these instructions at hand. So we can also see if people are using the system before the appointment and at the day of the appointment. And what we see is that 25% of the usage is the day before people have that appointment, so that people feel more comfortable and confident when they go on the road the next day. So integration into appointment communication is crucial.
Mm. We also have the technology within eyedog WiseNav to, if there's a part of the building that's under construction, we can also quickly make changes to direct people out of a certain way or make people travel in a certain direction. If there's another pandemic, for example, you only want people coming in one entrance and exiting another, exit. But we can make those changes in real time. So there's a whole lot of things to think about there, just having a bit of control of where you want customers and members of the public to travel. Yeah.
Yeah, agility. Yeah.
Agility, yeah.
Yeah. Thank you. We are doing really well on time. I'm really proud of us. Thank
Yeah.
you. I'm going to launch the final poll and also prompt the audience. If you've got any questions, please send them through now. We've got one more questions before I'm going to throw it out to the audience. That our final poll will be popping up for you now. Where do you see the biggest wayfinding breakdowns in your local health service? Thank you. Perfect. Thank you so much. We're sitting with the majority having those challenges within the hospital, and also getting back to the starting point is probably quite an underestimated part. It's great that you've made your appointment, but then trying to get out or getting to the next place, or a waiting place in between joining another queue or going to another specialty, how to get to the cafe in between to the next clinic, or how you get back to the front door and reverse your route. I know that that's an option within the eyedog WiseNav solution as well.
Yes, there's a little wee button there that says reverse route, and it takes you straight back to where you came from.
Awesome.
Mm.
So to finish our structured questions before we see what the audience might have for us, what are the key priorities that you think hospitals and health services should consider when implementing wayfinding technology, when surveying the market for wayfinding technology with the innovations available? What do you think is most important?
I think one of the most important thing is just engagement, customer engagement. How easy is it for them to use it? It's just there's no point having a very fancy system if people or 10 or 20 or 30% of the people are going to use it. It's got to be used by everyone, so it's got to be simple.
And what I always say is look at four things. One is wayfinding performance. Does it really do what it's intended for? Number two is wayfinding experience. Do people really like to use it? And is it not cognitively demanding? Is it simple to use? Because you don't want to stress people out while they are already stressed. And number three is just what Shay already mentioned is adaptability. That is super important. You can indeed have a fancy solution, but when it's not being used, then you're overshooting the mark. And number four is what we always call is agility. And you mentioned that as well, Ashley. Agility is how quickly can you accommodate to changes in the hospital. There are many changes over time. And as I mentioned earlier already, there are more than 20,000 routes, and there are easily going 6,000 routes going through one elevator bank. If that elevator bank shuts down for maintenance or whatever, you want to instantly reroute all these 6,000 routes. So you don't want to store all these routes statically. So all routes in our system are generated dynamically. So these are really four important factors to consider when thinking about investing in a digital wayfinding system.
Amazing, thank you. We've got two questions that I want to quickly cover off, and we'll be sure to respond following the webinar to the questions we haven't been able to get to. The first one speaks to a little bit what we've both referenced throughout the discussion, and that's changes to the building, changes to significant landmarks, or there's, lift wells under construction. How can hospitals make changes to these images, considering it is something that, is uploaded and
Yep.
static from that aspect? What's involved, and how autonomously can the hospital do that without relying on Faces, WiseNav?
Yeah. There are a couple of changes that there's a different categorization of changes. For example, can be a simple name change. Cardiology changes in hearts and vascular. That is something that can be done in a couple of seconds. Or a clinic move. Cardiology moves from the west side of the building to the east side of the building. That's also done in a couple of seconds. You also have, for example, pathways where there's a hallway where there was a new flooring job, for example. Instead of the floor is white, it's now brown. So you want to take a couple of new pictures in order to not confuse people. Hospitals can do that themselves. These simple changes can be done by themselves. When it comes to, let's say, big changes, there's let's say a completely new floor, or that floor has been taken down and built up again. That's going into collaboration, and that can be done partly by the hospital and partly by us. But like these changes for taking new pictures or creating first a simple path ways, that can be done in collaboration with each other. We have a tool in the system where we can tell exactly where to stand and which direction to face. Very simple icon, so people know exactly where to stand, take the picture, upload it, and done. That's it.
I love it how you say that, because I know it's not simple at all. There's so much research and mathematics and science and psychology behind it, and how you're delivering it, it makes it simple for the patient and for the client. Yeah, and for me to understand. So
Yes, thank you.
yeah, yeah. It's funny. Final question is, you mentioned before when we spoke about the cost of confusion is real, and it has a circa $500,000 impact on patient experience, and other sort of qualitative measures, which are acknowledged as qualitative, but they have significant flow-on effects. What is a potential cost saving for a hospital using photo landmark navigation in comparison to installing beacons and hardware and maintenance? What does the shift in technology and using a different sort of delivery method present to the hospital?
Yeah, ROI it also depends on what the current level of bleeding is, of course, and that is still hard to measure. Like it was mentioned by Professor Zimring already in 1990. But when it comes to in investment, well, the capital expenditure is way lower because you don't have to invest in the beacons. The thing is, it also depends a little bit how big your hospital is, because you need, let's say, every 1,000 square meters, you need at least one or two beacons. And it's not only that you need to buy these beacons, they need to be installed, they need to be calibrated. Also, the fact that batteries, they don't drain equally, so you need to recalibrate all the time. Also, what an important factor is testing. You need to really walk all these routes to really understand whether these beacons do a good job or not. In terms of supporting your indoor location technology to support wayfinding. So it's not only capex, but it's only the operational burden that you have, and it's really hard to put a number on that because it depends also how well they are. And so some implementations are done better than other implementations, of course, and also how big the hospital is. But that is, I mean, that is something that is not a headache for us at all. Implementations are done pretty quickly, also depending on how big the hospitals are. But let's say in an ideal project timeline, we could do a 100,000 square meter hospital in just under 2 weeks, and then you're ready to go.
Fantastic. Thank you so much. We've run to time, so I really appreciate all of our audience for joining us. Thank you again. You'll receive a copy of this recording as well in your email, so keep your eye out for that. But I'd like to thank you both, Shay and Ralph, for joining us. I'm
Very
sure
welcome.
everyone can see why we asked you to contribute and why we work with you. There's deep experience and knowledge in this topic, and it has real outcomes on patients and their experience and engagement with their health service. So it's extremely important and has a frontline impact. So thank you very much for joining us. Look forward to speaking to you guys again soon. But that concludes our webinar. Thank you so much.
Thank you.
Thank you.
Thank you.
Thank you.